Joint Active Systems, the range of motion specialists. Fitting your Joint Active Systems knee device. Initial setup. Before fitting the Jazz knee device, you will need to set the drive arms in the correct pinhole settings. Remove the pull pins and relocate the drive arms to the correct hole setting according to your end range of motion. Please ensure that both pull pins are in the same location on both sides. If they are not, they will cause the device's gears to bind. If the device is set up for narrow, use the narrow tower setting holes. If the device is set up for wide, use the wide tower setting holes. Getting familiar with the ratchet lever. The ratchet is used to drive the device into both flexion or extension depending on the setting of the lever. Rotate the ratchet in the direction indicated on the side of the device for extension or flexion. When the ratchet is working in the correct direction, it will be silent and you will feel the device moving. If you hear a clicking noise, the device is not moving and the lever on the end of the ratchet needs to be rotated. You are now ready to fit your Jazz knee device. We will demonstrate how to set up your Jazz knee for working extension first. Step 1. Loosen all the straps and place the device over your leg. Align the device over the leg, centering the tower directly over your knee. Step 2. Secure the thigh cuff straps and secure until they are comfortably snug. Ensure that the posterior cuff is lined up on the back of the thigh and that the two cuffs are not overlapping. Once the straps are secured, make sure the tower is still lined up over the top of the knee. Step 3. Adjust the device angle to match your end range of motion. To do this, extend the knee comfortably to end range. Ratchet the device so the tibia cuff makes total contact with the front of the shin. Step 4. Tibia cuff adjustment. Loosen the gray adjustment knob located on the inside of the device and position the tibia cuff so that it is centered along the length of the lower leg. Note, this may only need to be done one time. Tibia angle adjustment. Using the provided Allen wrench, loosen the angle adjustment screw located on the outside of the device and tilt the tibia cuff so that it makes total contact with the shin along the entire length of the cuff. Now tighten the screw back down. Note, this adjustment may only need to be done when approaching end range extension or flexion. Step 5. Secure the tibia cuff straps and secure until they are comfortably snug. Once the straps are secured, again make sure the tower is still lined up over the top of the knee. Step 6. Prop your leg up on a stool or a chair for support and begin your therapy treatment as outlined following the Joint Active Systems treatment protocol or as directed by your physician or therapist. We are now going to show you how to move the device from extension setting into a flexion setting. With the device completely removed, you will need to set the drive arms in the correct pinhole settings. Remove the pull pins and relocate the drive arms to the correct hole setting according to your end range of motion. If the device is set up for wide, use the wide tower setting holes. If the device is set up for narrow, use the narrow tower setting holes. For flexion, it is best to apply the Jazz knee device sitting at the edge of your seat. After it is fit, a small pillow or towel can be placed under the thigh to suspend the leg during use. Now repeat the fitting steps 1 through 6 to begin your treatment session in flexion. You have now completed the fitting of your Joint Active Systems knee device.